I feel that I have taken the right decision now.
Yes.
Yeah, on the day I was so I was just in a doubt that whether I should go for it or not. And
Right.
because my total field for the past 15 years almost, I was working with the pediatrics. I work for an NGO, and I started my own clinic in 2017. And the 17 to 20, I was running it. It was bit okay, and it's just improving.
Uh,
And in 20, when the COVID came, I had a very good bad drop. And
mm,
when this course, I went through this course, I was really hesitant to join it. But when I contacted you, told to speak to ma'am. So
mm,
ma'am was so amazing, and she explained me very well about the course, and the way she spoke is amazing. So the thing is, when I started the truth she spoke, that is
mm.
the physiotherapy.
Right.
But we live in our own mindsets.
Correct.
That if I have studied pediatrics, I have to go with the pediatrics. I should not see any other patients like that.
Correct.
But now I should say that after completing this course, I have a lot of confidence to handle the pain patients.
Mm, mm.
Now I started slowly. I am changing my own clinic also. Apart from pediatrics, I'm improving the pain area also nowadays.
Excellent.
Great.
Yes,
Excellent.
yes,
Excellent.
yes.
Yeah.
Good. Good. Good.
So thank you so much for introducing this such a beautiful course.
Thank you.
Thank you
Good.
so much, ma'am. Thank you,
Right.
sir.
So you are basically from Coimbatore, right?
No, Pondicherry, sir.
Pondicherry, right? So we have another
Kirpa.
mentee there, Kripa there.
Kirpa. Yeah, I spoke to him also.
Yeah,
Yeah,
you
you
spoke
gave
to
his
him
number.
as well. Right, right,
Yeah.
sir. Good, good. So how far you are basically from that particular place as such?
Actually, we are in Pondicherry is almost around the 20 square kilometers only. So
Acha,
around 5 kilometers distance only from
acha,
here.
yeah, 5 kilometers. He's visiting Pune on 19th, so we'll share the pic as well.
Okay.
Great, great, great. So what percentage is basically changed in terms of patient flow, Jaising?
uh, Patient flow has increased, and the thing is, as I was talking with ma'am earlier, I used to give pediatric patients only 2 days or 3 days in a week. That
Yeah.
I nowadays I have started. I have told them strictly that they have to come all the day in the week,
Mm,
and that has converted of many things. And slowly, new pediatric cases also started coming, and pain patients also started coming. And the
mm,
results I am seeing in that grading of exercises, 1 or 2 days, they are saying the changes in that. They
mm.
feel that the pain is not at all there.
Correct.
It is wonderful. It's wonderful, wonderful.
Right,
Great.
right. So the focus should be on the sustainable results as such,
Yes,
right?
yes.
So once the focus becomes very laser this thing that yes, sustainability. Okay, the sustainability could be 10 plus years as such, right? So when you focus that level of results, believe me, you are going to get a huge references, right? So they from their family members, from their friends, and from their all around as such, they keep on referring the patients as such, right?
Yes,
So
true.
you are attached to any hospitals, or how is it in terms of
No, no, no,
treatment?
no,
So
no.
you are all alone actually, right?
Yes, yes.
Right. Good. It is good. So one good point you raised actually about the mindset, right? See, see, almost in every batch as such, around 20 plus physios, do do participate in the level 1 program as such, right? The first level program is for them to change their mindset. Okay, for them to understand what's the right physiotherapy as such. But even if after that they don't take action, then it is very difficult for them actually. The reasoning is we can't speak to everyone, right?
Yes.
Because it's very difficult for us also to take out that time and speak again individually, right?
Mm.
So that's the reason they must also understand that when they have proved their worth or their these things in this 3 to 5 days as such, plus it's just not that we have shown our growth also, okay, with the financial results, with the return filings and everything also, right? So they should give it a try for themselves, okay? So if they don't do it, then we really feel pity for them actually. In spite of undergoing these things, if they are not able to take that decision, then how can we help them?
Yes.
Okay, because ultimately we want to help them. बट यस सबका नहीं हो रहा है, बट ठीक है, जब होता है तो देखेंगे भी क्या कर सकते हैं. Good. So what's your future plan, Jaising, now?
Yeah,
In terms of growth.
yes, I'm going to establish and hire some therapists again now in 1 or 2 months. So I'm planning to full-fledged department clinic in a full-fledged
Right.
pain and the neuro, everything combined together. Earlier, I was focusing only for the pediatrics. If somebody comes, some friends or some relatives comes for the pain, I used to treat them, but I don't take much care for them. But now I feel that it's a very big confidence for me. So
Right.
much interest has been created in me now.
Right. So how many on an average you have patients now?
Per day, I used to see 10 to 12 patients.
10 to 12. Okay. So if and out of that, how much percentage is pediatric?
Pediatric is around 60%, 6 or 7 patients, and
7 patients is around this thing. So yeah. So pediatrics again are what? Long-term cases? What kind of a pediatric do you see actually?
Cerebral palsy, CP cases.
CP cases. So that they are, especially the long-term.
It's a long-term.
Yeah. Cases itself, right? So also, we used to have even from the Pondicherry also, right?
Yeah, across India.
Across India,
even
Ghaziabad. Okay. See, guy, Jaising, see to it that you join L3 program also, right?
Yeah.
So there are lot of learnings from there. Okay, in terms of these cases as such. Okay, you need to be very again specialized in terms of these cases also in the one which we are basically providing you in other things. Okay, and since you being senior, you must make sure that you move towards excellence, right?
Yes.
So excellence is must for the seniors. Okay, I understand for the beginners as such. Okay, they may take certain time as such. Okay, but for this things you have already reached that stage now. Okay, so you don't have to wait any further, right? So make sure that you be a part of this excellence program also. Okay, that will gain a lot of confidence. And these are most of the cases are again the maintenance, right? So and in a how many physios must be there in Pondicherry in your that 20 square kilometer area?
Lot of physios.
ठीक है ना, कोई problem नहीं, but how much?
Nowadays there are 4 colleges newly started. In one college itself, they are taking 60 candidates.
नहीं तो ठीक है, practitioner. I'm talking about basically practitioners.
Practitioners now maybe around 30 to 40.
So nothing. You see, just imagine out of those 30 also, you two guys become the most, the treatment providers in terms of quality. Okay.
Yes.
So understand one thing: more the practitioners, better the awareness, right? So if you guys are not present, then there is a huge problem. Lesser the number of practitioners, greater the problem. Because people don't believe. Why there are only 2 physiotherapists is there? अभी यहाँ पे एक बंदा है, 10 किलोमीटर के बाद और एक बंदा है. So they don't even care. But imagine in one single area, some 5 to 6 practitioners are there. So the awareness becomes higher.
Yes.
Here also I see the physiotherapist. Here also I see the physiotherapist. I have so much of a problem. Then just let me get in. That's how the patient flow also that organized flow जो बोलते हैं ना हम लोग, ठीक है ना, जो walk-in patients जो बोल सकते हैं so that becomes increased, right? So don't ever think about the competition as the more the competition, it is better, because now guys, you are the world's best 150 physiotherapists. Yes. Imagine. Okay, you are among those only 150 world's best physiotherapists who knows this knowledge. Okay, you go to any, you damn tell patients that you go to any patients and see the way we educate. First of all, they educate with you that this thing is not there itself, right? That education part itself is not there because they themselves are not clear. Because the clarity makes you a very crisp, and that you get connected to the patient, and patient also get connected to you. That clarity is required. Clarity in speech, clarity in justifications, clarity in the delivery, clarity in the prescriptions, clarity in everything that you do. Okay, you will get a patient some responses that he knows what he's doing. That means that is very very clear कि आप जो बताते हो वो आपको पता है कि आप क्या बता रहे हो. Right, that's very very this thing, right? Good. So with 10 to 12 patients, I think you should be able to make 1.5 lakhs with pediatric cases included.
Around one plus or minus.
1 plus. So you have a people with you? You have a physio with you?
No.
Okay.
I'm planning to hire people.
Okay. Okay. So you must increase your patient base also. Okay, I think you should have 20 plus. Okay, minimum. Okay, see to it that you conduct one, the marketing, the way it is told. Plus, when you follow this practice as such, that 30-day ka jo discharge period hota hai, that itself will increase your patient base actually, right? So even after discharge, make sure you keep a very good relationship with the patient, so that they'll these things. Okay, make a patient WhatsApp group as such. Okay, keep sending them about the stories, the success stories of the patients, right? So they should always know from you that aisa cases hua hai yahan pe, this is the case that has been. Let them see kya hota hai. They may not be having a problem, but the moment they understand yes, there is a treatment available for this also, then they refer. Okay, so they have many people in the circle, but they do not know what is the right treatment for this. And the biggest problem for the patient is they do not know what is the right treatment for my condition as such. But they keep on experimenting. Okay, yes. But when you have the results before and after as such, okay, that gives a huge boost for the patients as such. Okay, so make sure you do that, right?
Yeah.
Great. Thank you, Jaising, for sharing your.
Thank you, sir. Thank you, ma'am.
Okay, and I wish you all the very best. Okay, and make sure that you keep sharing your. Now you'll be put into the group where all the people have completed the certification program as such. Okay, so a lot of things go on over there. Okay, so we keep on there are a lot of success stories also they do share. So it's a completely an inspiration, okay, for everyone over there. Okay, plus we also share a lot of things in that particular group as such. Reason is here we wanted a focus in the current group as such. We wanted a focus. Okay, we don't want them to because there is a lot of learning, lot of busy schedule that basically goes on. The moment they earn, now it's the question of sharing the stories as such, right? So make sure that we'll put that, okay, and do share your stories as well, right?